My name is Joey Starke. I'm a family medicine physician with Southeast Primary Care. I was born and raised in Jackson, Missouri, went to Jackson High School. I went to St. Louis University for college, and then I went to Lincoln Memorial University out in East Tennessee for medical school. I always wanted to make sure we got back home. I think the people of Southeast Missouri deserve great medical care. What I really liked was the philosophy of osteopathic medicine. The very first thing that they teach you is that it's a holistic type of approach. So the person is made up of a unit of a body, a mind, and a spirit. And so that underlies everything that we do. We also believe that the body has the ability to heal itself. So anytime we can help correct the anatomy if it's off, it can do the job better and it can do its function better, but the body is going to help heal itself in that way too. So with osteopathic manipulation, what we're trying to do, and most of the time people come in for muscle complaints or bone complaints or some kind of pain, we're trying to make sure that the structure is where it's supposed to be, making sure that things are lined up so that the body can heal itself and go back to where it needs to be. I really see it as one type of tool, like in our toolbox. So I'm using medications, I'm doing the imaging, I'm making a diagnosis, and then this is one part of the treatment. Like a traditional family medicine practice, we can see patients of all ages. That might be newborns, toddlers, kids in school, all the way up through adults and elderly patients as well. When a patient comes to see me for the first time, I do everything I can to get to know them in that first visit. So they might come in for an acute problem like a sinus infection, and we'll certainly address that. But I'm probably going to ask a lot of questions about medical history, surgical history, medications, all of those sorts of things that go along with your medical history. Medicine used to be all about acute illnesses. So if you look at the progress of medicine, at least in, you can just take the example of medicine in the United States over the last 200 years. Our main goal was to get people better when they became sick. People had shorter life expectancies. We weren't seeing things like heart attacks or strokes or long-term diabetes or neuropathy. The reason that you need a primary care physician is to take care of all those things. If you just go to the doctor when you're sick and you go to a walk-in clinic or the ER and you're just sick, then they're going to take care of that one problem, but you're not going to get all the other care that you need. You could be missing out, or you could be developing something that maybe you don't have symptoms of right then, but it's going to affect you 15, 20, 25 years down the road. And we want to start treating that early and prevent it. A wellness examination once a year is a great time to do that. We can go over all of your medical history, make sure you're up to date on all of your screenings. And again, you don't necessarily have to have symptoms or feel bad that day, but we're going to prevent disease 5, 10, 15, 20 years down the road. Primary care physician's job is not only to do the screening, but then coordinate all the care after that. Our nurse practitioners are great extenders for the care that we do in a primary care office. They're going to take care of you with the same quality of care that the physicians do. And we're always collaborating with them and talking to them about patients. When I'm not at the office, I'm at home with my kids and my wife and enjoying time with them. We try to get out as much as we can, take the kids to the park, take them to Grandma and Grandpa's house, go swimming, and during the summer and that kind of thing. We were very involved in church, Immaculate Conception in Jackson, so we're always involved in those activities. And if we have the opportunity, we'll take a trip to St. Louis, go to the zoo, go to a Cardinals game.